Hey future nurse, let's tackle this NCLEX question on pharmacology. A client with congestive heart failure has been prescribed 40 milligrams of furosemide intravenous. Which of the following findings indicates the nurse needs to hold the dose and notify the healthcare provider? First thing you're going to do in a pharmacology question is see if you can identify the medication. What drug class does it belong to? So if you didn't know prior, furosemide is a diuretic, and whenever you come across a diuretic on the NCLEX, you need to ask yourself, is it a potassium-sparing diuretic or a potassium-wasting diuretic? Now, furosemide is a potassium-wasting diuretic, so you have to ask yourself, what's my normal range for potassium? And that's 3.5 to 5. So anything below 3.5 places the patient at risk for hypokalemia. So now knowing this, option C is going to be our answer because a potassium lower than 3.5 in the setting of a potassium wasting diuretic, we are going to hold that dose and we are going to notify the healthcare provider. Now let's just review the other option choices and see what we can learn from these option choices. So A is sodium level of 137, that is within normal range. Normal range for sodium is 135 to 145. Option B is weight gain of 5 pounds in the past 3 days. Remember, this patient is a congestive heart failure patient. They are prone to retain water in acute exacerbations, and the management for that is actually diuretics. So this patient is in the setting of appropriate treatment if their potassium is within normal limits. And lastly, option D, pink frothy sputum noted when coughing. So a lot of people actually pick this answer choice because they think airway and they kind of get scared when they see that pink frothy sputum. However, look at the patient that we're treating. This is a congestive heart failure patient, and somebody with left-sided CHF is going to have fluid back up into the lungs, and that's actually a sign of pulmonary edema or fluid in the lungs. So in this situation, I want to give a diuretic because I want to excrete that fluid. But as we learned from this question today, a potassium-wasting diuretic is contraindicated in hypokalemia. So always make sure that you assess that in these questions. I hope you learned something. Follow for more.